Hi, my name is Stephanie Spicer and I'm a lymie. I'm not a doctor or a dentist, so what I say here shouldn't be taken as medical or dental advice. I'm just one lymie sharing my experiences. I'd like to talk a bit today about how Lyme disease affects dental health. I don't normally make videos dealing with specific symptoms, just because Lyme disease has so many different symptom manifestations, and I can't make videos about all of them. I also believe that instead of trying to treat symptoms one by one, we should focus on hitting at the root of the problem, Lyme. Nevertheless, I wanted to make a special video about this issue just because it has affected my life so much. Over the past few years, I've had absolutely horrific dental problems. I've had an extraction, 5 root canals, and I don't even remember how many fillings, accompanied by some of the worst pain of my life. I hope this video can help you avoid some of my pain. Lyme bacteria don't tend to just hang out in the bloodstream. They can burrow into soft tissue, cartilage, bone, and even cross the blood-brain barrier. They can also infect our teeth. Lyme bacteria like to hang out in the dentin of the tooth. That's the part beneath the enamel and surrounding the pulp chamber and root canals. The dentin in our teeth contains around 3 miles of tiny hollow canals called tubules, which form a perfect space for the bacteria to inhabit. Bacteria also like to occupy areas affected by root canal and extraction procedures. Needless to say, their presence and general toxicity create a lot of problems, including facial and dental pain, facial palsy, headaches, TMJ, jaw pain, periodontitis, and inflammation. To make matters worse, the dental procedures made necessary as a result of Lyme toxicity can contribute back to create more inflammation and send us down a spiral of increased symptoms and confusion about how they should be interpreted and treated. I also wonder if the strain of going through Herx reactions put undue pressure on my teeth, as their rigid nature creates a particular challenge to detox out dead bacteria and their toxins. I certainly don't have all the answers, but I'd like to share a few things that I've found helpful and that are recommended by Lyme-literate dental practitioners. 1. Brush and floss every day. I know it sounds basic, but it can be a huge burden when you can hardly manage to get out of bed. I'd like to challenge you to make it a priority. 2. Use a soft brush to avoid unnecessarily inflaming your gums or damaging previous dental work. Some dentists also recommend using a water pick instead of floss. 3. Go to the dentist when you need to and don't wait. I know it's expensive and unpleasant, but avoiding the pain of a toothache is worth it. 4. If you have fillings made from metal, consider getting them replaced with composite. The heavy metals used in amalgam fillings can seriously inhibit your ability to heal from Lyme. 5. Work on your pH to reduce acidity, and work to keep inflammation under control in your mouth and throughout your body. Reducing your sugar intake can help with both of these. 6. When you go in for a dental procedure, let your doctor know that you have Lyme disease. 7. Detox your oral cavity by practicing oil pulling. I really wish I would have known about and started practicing oil pulling years ago. I wonder if I could have avoided some of my problems if I had. I'd also like to share something very specific that has helped me. A ratio of 1 drop clove oil, 3 drops oregano oil, and 4 drops cinnamon oil added to my oil pulling in the morning, or just diluted in olive oil and used as an ointment on my gums, has helped me immensely with fighting oral infection. Now, this isn't a replacement for actual dental care or work, obviously. And I should also note that I reacted to it very strongly at first with dizzy spells and night sweats, perhaps due to oregano oil being a biofilm buster, and the other oils possibly being effective not just against Borrelia, but against Bartonella, Babesia, and parasites as well. It's important to detox afterwards so that the toxins released by dead microorganisms don't just sit around inside your jaw. I find that putting dry clay powder or activated charcoal powder in the area between the gums and the teeth or under the tongue and leaving it overnight can help. I've added a link in the description to an article I wrote about a kind of spiritual experience I had when I was going through the worst pain of my life. Feel free to check it out if you want. And until next time, keep on fighting until it's over.